You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, how small improvements made to your smile can make a big difference in your life. Not only how you feel about yourself, but how others perceive you. We're also talking about sedation dentistry. According to my first guest, he says, don't let your fear of the dentist keep you from having the smile you've always wanted. With us, we have Dr. Haines. Dr. Haines, welcome to the program.
Thank you, Randy. Thanks for having me.
Now, before we get into today's topic, for people that don't know your practice, who's the typical patient? What are the different services you offer? I've met your partner, Dr. Watanabe, big personality guy.
Great guy.
So what all do you do?
You know, Randy, the typical patient is pretty much anyone. People come to us with, little simple things that need to be done, just, as simple as a cleaning or whitening. And then they come in with large problems too, that they don't even know if their teeth can be fixed. So we do, tooth-colored fillings, porcelain crowns, veneers, Invisalign. We do dental implants for single teeth. We'll, people that have dentures that don't fit, we will do implants to stabilize those dentures. So we do...
and sedation. I mean,
we do sedation.
You're big on sedation.
Love sedation.
Why?
Well, because people come in and they are so scared of the dentist. And,
Do they tell you that?
Oh, all the time.
Like, no offense, doctor? Or what do they say?
No offense, doc, but I hate the dentist.
Really?
Yeah, and we usually laugh it off together, but I'm laughing because I know that in the end, they're gonna love their new smile. Their perception of the dentist and the dental office is gonna be totally different than when they came in, because they are going to be totally comfortable while the procedure's being done. They're going to feel no pain whatsoever. So yeah, it's...
Now you work with Dr. Watanabe. He's your partner. And I guess you say everybody knows him in St. Louis.
They do. He's been around for quite some time.
I met him. He has a big personality.
Big personality. Just a wonderful, wonderful individual.
What does he do and what do you do? Or do you do the same stuff?
We do a lot of the same things. But when he started the practice, his philosophy was he wanted people to be comfortable and enjoy going to the dentist. And that's really what our practice was kind of founded on.
Okay.
Over 35 years ago, was changing people's idea of the dentist. And that's where his personality really comes in too, is because he's such a likable person that people loved coming to see him. And so that really began our journey into the sedation dentistry, where people are comfortable and it's a totally pain-free experience.
Now, in your practice, and we've talked on the phone, you have this you do everything under one roof kind of a thing.
Right.
Root canals, extractions, you pretty much, dental implants, you do everything there.
So we do a lot in our practice. People don't want to go to another office. So we do things, again, simple fillings, we do root canals, so we take all sorts of continuing education so that we're able to provide these services for people. And that's what we love to do. We love to learn, and so that...
Smile Makeovers, we talk about at the top of the show, Smile Makeovers, sedation dentistry. Are there a lot of people that don't like their smile? It sounds like an obvious one, but...
You would, yeah, to me it is. But there are tens of thousands of people in the St. Louis area alone that don't like their smile. And they're self-conscious about it. They hide their smile. And so people perceive them maybe not as how they are. And just simple little things can be done to improve it, to make it better, so that they feel confident about themselves, so that they have a little bit more charisma.
So you're a dentist.
Yes.
So you probably think the smile is pretty important.
Well,
how important is it?
I mean, of course I'm going to say it's everything.
Okay.
But don't take my word for it. I mean, there's been surveys done I think the last one I saw was in Men's Health magazine. And again, the smile was top on the survey as far as what was most attractive to the opposite sex. You would have thought it would have been like physique or something like that, but it was the smile. It's one of the first things that people see when they look at you. So I like to say it's the ultimate accessory.
Okay.
I mean,
Now, sedation. You do oral sedation for the nervous people,
right?
And you do nitrous, which is like the gas.
The gas,
So,
laughing gas.
Is that big? I mean, a lot of people are taking advantage of this.
It depends a little bit upon their anxiety level. Some people might think that they're super nervous, but just a little bit of laughing gas will get them relaxed to where we can get things done. Other people, they need the oral sedation where they're extremely relaxed. We're able to do a lot of work, correct a lot of problems, and they have little to no memory of what happened. So,
now with oral sedation and nitrous, we talked in the green room. You say that you could do like 6 months worth of dentistry in one day. What does that mean?
Absolutely.
Mean when you say that?
Absolutely. We see it all the time. People put things off a little bit too long, and it's going to take several appointments to get things done. But with the sedation, we can do it all in 1 or 2 visits. So it saves people a lot of time, a lot of hassle going back and forth. You know, you may be, if you're awake, you might only be able to hold your mouth open for half hour or an hour max. With the sedation, we're able to get everything done and do it comfortably to where you're not going to have any pain.
We're talking about Smile Makeovers, cosmetic dentistry, and sedation. You brought some photos. What are we looking at? So
here's a person that comes in. She wasn't happy with her smile. It was discolored, uneven. You can see along the edges there was some chipping and things were getting flat. So this is what she didn't like. She wasn't confident in her smile any longer. The discoloration was bothering her. She just didn't have the self-confidence. And so she didn't smile like she used to. And when you see the end result, you're gonna notice the change in her smile.
So when you see this, by the way, as a cosmetic dentist, what are you thinking?
I'm thinking, wow, we can make a huge difference for her. We can have an impact. So could we do a little Invisalign here? But ultimately, if we straightened her teeth, that's not going to get her the result. We needed to resurface everything.
Okay.
And so we decided to go with porcelain veneers to recontour the edges of her teeth, take out the discolored bonding. We did a little gum lift so that she wasn't so gummy in her smile. So that just made a huge difference for her. And let me show you the after.
All right. Very nice.
And you can just see how confident she is in her smile. She gets a few compliments and wow, you look different. What's different about you? People usually don't say, oh, your teeth look great. They just tell that there's something different. Maybe it's your hair, maybe it's your skin, but it's because she's more confident and her smile's changed.
And those are veneers?
These are veneers.
I think I told you that I feel like I could spot veneers walking down the street. They look big and bulky.
Right.
Is that the hands of the dentist, or is that what people want?
You know, I think it's a little bit of a miscommunication, honestly. People tell the dentist, oh, I want a white smile. And so the dentist's like, oh, well, geez, I got to give him the whitest thing that we can do. And that's really where the art comes in, is in the color and the natural appearance, how the teeth naturally grow out of the gum tissue. So that's really where the art comes in, and that's what I love. And you can see we spend a lot of time getting it to look natural. Because again, people don't want their teeth to walk in the door 10 minutes before they do.
The big teeth.
The big teeth,
big
exactly.
veneers.
No, they want them to look natural. They may say they want them white, but they mean natural. Now look at the after. I want to point a few things out. Look at how her smile is full. It follows her lower lip. It's broad. There's no dark spaces around the corner of her mouth. You look at the before picture. That's a worn, almost old-looking smile. If you take care of your teeth and you live long enough, your smile's going to wear down.
Okay.
You look at the after. That's a youthful smile. There's some natural curves to the teeth, feminine, and we spend a lot of time determining how it's going to look best on her. A male may need a little bit bolder of a look to their teeth, maybe a little crisper. A female, they need the curves.
Okay.
And that makes the difference. The front two teeth, they might be just slightly longer than the laterals or the next teeth over. Again, that makes it more youthful looking. So the day that we do this, it's such an emotional experience for the patient because I know what it's going to look like, but they don't. And so when they see their smile for the first time, it's really powerful. So often there's tears. Generally, there's a hug involved, and
Okay.
that's the biggest reward for me is to get that hug, because that's when you know that it's made a difference for them. So these people, and they're perceived differently. Their smile, we see them later on when they come back for their cleanings and things, and that's when we get the real stories about how different they feel, how their family and friends view them, and it comes from that confidence that they get when they can smile and show people their true emotions.
Now, is this one of those things where they say, I should have done this years ago?
All the time. I mean, they're like, why didn't I do it sooner? I just, the other day, delivered a case, and she was telling me that her daughter noticed and said, Mom, it's about time you got rid of those yellow teeth. And she's like, I know, I should have done it sooner. And so that's why it's such a simple thing to pick up the phone. If you're not happy about something, you can change your smile. It doesn't matter. It can be simple. Worst case scenarios, we're using implants and we can give you a new smile. So it can be done.
Now, I talked to your assistant, and she said, it was so funny. I mean, she's obviously not going to be on the show, but she wanted to make sure that he gets across that the veneers that we do, they look natural, right?
Right.
They don't look phony or big or bulky.
Right. Absolutely. That is what all of our continuing education, that's why we love what we do, is because it's an art, and we spend that extra little bit of time to go above and beyond to make sure that it's what the patient needs.
Are a lot of the cosmetic patients, are they getting sedated?
Yes, a lot do. It's just so much more comfortable to do it that way. You can do it without, but why not be comfortable and relaxed while it's all being done? And so yes, we do a lot of sedation. So here's a young man that was not happy again with his smile. I mean, we pretty much had to tickle him to get him to show his upper teeth, okay? And you can see that it just makes him look like he doesn't take care of himself, okay? And he's in his young 20s, okay? And so his parents wanted to set him up for success.
Okay.
And when I show you the after, you'll see why, okay? And you can see in this first picture that the space between his front two teeth is off to the side, so we had to
So
move that
it's supposed to be
over.
centered with the nose?
Supposed to be centered with the nose, right? Exactly. So we had to take that into account and give him a nice, bright smile. And so let me show you the after.
So what did you do for him?
So we used porcelain to take care of everything. And again, it
Wow.
it makes him look more put together, makes him look like he has a higher education.
That's true.
Yeah. Again, his parents helped him out, took care of this for him so that he would be
So people
successful.
like this in St. Louis, they don't smile. So they're walking around not smiling.
Nope.
They get it done. Now here's a young guy. When he sees himself in the mirror for the first time,
He's like, wow. It was almost like I didn't know it could be this good. You know, it was like I didn't know what I was missing. And so they're super happy when they leave. And when they come back, it's the stories of people look at me differently. I feel better about myself.
do you
I'm
think
not
people are
hiding.
prejudged? Like when we look at his before photo,
Yeah,
he's probably prejudged. I mean, he looks like just a young kid
right.
with bad teeth.
With bad teeth. That again.
And now he looks like a very sophisticated guy in the after.
Right. That didn't take care of himself. Now he does.
So one afternoon.
One afternoon, and he's done. In one afternoon, his whole life has changed. His destiny has changed. And that's the power of a new smile.
Now, there is not a recognized specialty as a cosmetic dentist,
Correct.
right? But you've had a lot of continuing education.
Absolutely.
Is that right?
Yes.
Is there that much to this? Because not
There's-
every dentist does cosmetics, right?
Right. No, there's a lot that goes into it. And that's where the continuing education comes in.
Do you think you have an eye for it?
I do. I absolutely, because I spend so much time that, I'm a little bit of a dork.
right.
I enjoy learning about it and because of the results that we get. So I want to keep getting better. But yes, I definitely have a trained eye for it.
So who comes in for this, by the way? Is it more of the 35 plus, 40 plus crowd? And how old are people coming in for cosmetic dentistry these days?
It can be a teenager that just got their braces off that wants to whiten their teeth. Or it could be somebody that's going through a divorce, could be somebody that their child's getting married or getting married themselves, and so they want to look great for their pictures. Could be somebody that's going to a class reunion, so they're going to be seeing their old friends.
Do people do this on an occasion, usually?
It can. Or it can just be because they finally got to the point where they knew something needed to be done. So it can be an occasion, but oftentimes it's just because they know that their smile's gotten to the point where they need to fix it.
Now, since you and I talked, because you were telling me how people hide their smile, on Facebook, right? A lot of people don't smile. Do they take more selfies now of smiling on Facebook? I'm curious.
Absolutely. I mean, that is one of the biggest things are these selfies, right? And so when somebody takes a selfie, what's the first thing that you see? Their smile. So that's why it's so important. You can take these selfies that are these pouty ones, but the smile looks so much better. So yeah, it's a huge impact with the technology that's out there.
Okay, good. We have time for a few more photos.
Okay. This young man, as you can see, has some spacing going on. Again, he's a younger guy, late 20s, finally on his own. Wasn't able to have braces when he was younger. Needed a fix though for the spaces in his teeth. It had bugged him forever. And he needed to do something economical. And when I show you the after, you're gonna be blown away.
Okay.
Because we were able to do this with no anesthetic, okay? So totally pain-free, one afternoon, probably took about an hour and a half, and we used some bonding, and the difference is incredible. He loved it. He was blown away. He didn't know it could look that good. he was grinning from ear to ear, as you can see in that picture. So afterwards, the difference in how he felt about himself, he was so much more confident with his smile. And so the difference afterwards, it just gives him so much more confidence. You know, if you looked at somebody, if you had two people going in for an interview and one had a confident, attractive smile and the other didn't, yet both had similar backgrounds, every time the person with the smile is going to get the job.
I mean, if it's a job interview and somebody is not smiling.
Yeah. They look grumpy. They look like there's something wrong.
Good point.
You know, so that's why the smile can make all the difference. Now, here's another woman. You might not be able to tell that from the picture, but this is a woman who came in and worn down teeth, discolored. I knew this was going to be great. When I saw her, I was pumped because I knew that we could make a huge difference for her. And we could have done Invisalign, but it wasn't going to change her teeth. She needed to have them more feminine. They almost look like teeth from a 75-year-old man. So what we were able to do some no-prep porcelain veneers for her. Now, normally we have to grind the teeth down to put veneers on, but her case, we didn't need to do that. We just were able to put porcelain veneers right over the top. And so after, she was just blown away. One afternoon,
It is a change. It is a huge change.
Yeah, I mean, she looked 15 years younger in this picture. And it was in one afternoon we were able to do that. Look at the before on the corners of the mouth. It's dark, it's like a shadow. In the after, her teeth fill that space. So it looks like she's got a broad smile. And that's what we mean by a broad smile. The other thing I want to point out is in the first photo, the before, there's a gap between her upper teeth and her lower lip. In the after, her teeth follow that lower lip. And that's the difference that a cosmetic dentist can make. Because we look at these things. We make the teeth follow the face or fit the face.
And they don't look like veneers, really.
They don't. They're so natural. And that's why nobody really knows, but it's a huge difference.
Good.
Here's another guy, kind of a funny photo, but he just didn't even know how to smile.
So that's his smile.
That was his smile. I mean, he just did not even show his teeth at all. And guys use facial hair to cover up their bad smile all the time. We see it all the time. Afterwards, they'll trim it or they'll cut it off completely. And let me show you the difference in the after. It's incredible. We had to retrain him how to smile, but you see how he's trimmed up his beard, and the difference.
It's a cleaner look. There's no doubt about it.
It's a cleaner look. He is just so much more confident in himself. People perceive him differently now. Before, they didn't know what to think of him. Now he looks like he's put together.
Yeah. Like
he has a high education. So just his charisma is totally different. Again, I love this patient because this is a great example of what cosmetic dentistry can do. You take a tooth away from anybody, even a supermodel, and they're no longer a supermodel, right?
Yeah, yeah.
So this proves the point. So with him, what we had to do, we used some crowns and a fixed bridge to replace those missing teeth, the broken ones, the discolored ones. We gave him an entirely new smile.
Let's take a look.
All right.
Very nice.
And you can see how happy he was. His wife was probably even happier than he was. She's the one that got him to come in and get this
Is that
fixed
common?
finally.
The spouse or partner has to drag the other one in?
Yes, usually. Because a lot of times the change in a smile happens so slowly that we just gradually become used to it. And he had gotten used to it. And it's a lot of times, not until somebody points it out that somebody takes action. So if there's something that you don't like about your smile, there's no reason not to do something about it. Because there's so many different things that we can do.
And most of these people, we're talking about sedation today also.
Yeah.
They get an oral sedation or nitrous.
There's no reason to be
So
scared.
it's easy.
No reason to be scared. Because we can use a little sedation to take care of those anxieties. Maybe a little laughing gas. We do something it's called New Calm. It's a more natural way to be relaxed in the dental chair. So there's a ton of different options. Again, no reason that you should put this off.
No more excuses. Now, we are literally out of time. Final message to the patient watching this, or the person watching this, they don't like their smile. They're afraid of the dentist. They think it's too expensive, or whatever. What do you say to them? But they hate their smile.
Come in, talk to us. Let us tell you what your options are. There's so many things, whether it's little, that as simple as whitening, simple as recontouring, some pointy canines, doing a little bonding, that can have a huge impact. So don't hesitate. Get in. Let us take a look at it.
Free consultation?
We do free consultations all the time. Absolutely. So there's no reason you shouldn't know what we can do to make a huge change for you.
All right. I want to thank you for coming on the show. Very interesting.
Randy, thank you.
Yeah, good work. And these photos are all on your website? They can take a look?
Yes, they're all there.
All right. And they could ask for Dr. Haines to do it?
Yep.
You'll meet with him in person? I hear you're
Absolutely.
Funny also?
I think so.
There?
We love having a good time in our office. Right. And we want people to feel comfortable. And laughter does a huge thing for that.
Okay, good. I want to thanks again. You've been watching The Wellness Hour. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.